This is Hamza Shahzad, a third year BD student from De Montmorency College of Dentistry, Lahore. Today, I am presenting visual dentistry not as a technological trend, but as an evidence based communication intervention that directly targets one of dentistry's most persistent problems: patient anxiety. Dentistry rarely fails due to lack of clinical skill. It fails when patients do not understand what is being done to them. Visual dentistry addresses this gap by transforming uncertainty into understanding and fear into trust. So, moving on with the historical and biological foundation, to understand why visual dentistry is effective, we must first understand how humans process information. Visual communication existed more than 30,000 years before written language. Early humans used images to explain danger, survival, and shared experience. This evolutionary dependence on visuals remains embedded in our neurobiology. Images are not optional aids, they are the brain's primary language. Therefore, when dentistry relies purely on verbal explanation, it works against human cognition rather than with it. And neuroscience supports this strongly. Over 90% of information sent to the brain is visual, and visual input is processed to 60,000 times faster than text. One might assume that clear verbal explanation should be sufficient. However, verbal explanations require abstract interpretation, while visual explanations allow instant comprehension. Visual dentistry aligns clinical communication with the brain's natural processing hierarchy, making understanding effortless rather than forced. So, you might ask, why dental anxiety even exists? Dental anxiety is commonly assumed to be the fear of pain, but evidence consistently shows that the strongest trigger is uncertainty. When patients cannot visualize a procedure, the mind fills the gaps, often with exaggerated or catastrophic assumptions. This leads to fear, avoidance, delayed treatment, and poorer oral health outcomes. So, dental anxiety is not inevitable, it is largely modifiable. 36% of adults report dental anxiety, and 12% experience extreme dental fear. Importantly, fear of unknown procedures outweighs the fear of instruments or injections. This reframes this reframes anxiety from being purely psychological to being a communication failure, one that dentistry has the power to correct. So you might ask how visual aids reduce anxiety. Visual aids replace imagination with information. They convert abstract explanations into tangible, predictable processes. One might argue that visuals merely comfort patients emotionally. However, multiple studies demonstrate objective reductions in preoperative anxiety by approximately 35 to 40%. This confirms that visualization produces real clinical impact and not just reassurance. Anxiety and pain are neurologically linked, with higher anxiety amplifies pain perception through anticipatory stress pathways. By reducing uncertainty, visual reassurance lowers perceived pain by 20 to 30% without additional medication. Visual dentistry indirectly enhances pain control through psychological modulation. Patient-centered care requires informed consent, shared decision-making, and trust. Visual dentistry strengthens all three. Patients who understand their condition feel respected and involved. Research shows that 25 to 35% increase in patient satisfaction occurs, and higher trust scores and fewer post-treatment complaints. This is not just better communication, it is better ethics. Moving on with the techniques that we can use in visual dentistry, we can use intraoral cameras, digital radiographs, chairside monitors, models, and animations to show the patient what kind of procedures are going to be done on them and what we are going to perform on them as dentists. And visual dentistry uses practical tools such as intraoral cameras, digital radiographs, chairside monitors, and models. If verbal explanation alone were sufficient, these tools would not significantly alter outcomes. If Yet evidence shows treatment acceptance rises approximately 35 to 65% with verbal explanation to 75 to 85% with visual explanation, especially using intraoral cameras. Thus, they are the most effective technique according to researchers. This establishes visual explanation as objectively superior and not merely supplementary. When evaluated collectively, anxiety reduction, pain perception, patient satisfaction, and treatment acceptance, the benefits of visual dentistry are consistent and reproducible. This makes visual dentistry an essential clinical strategy and not an optional enhancement. To conclude, visual dentistry transforms dentistry from fear-based care to trust-based care. Some view it as a technological luxury, but when an approach reliably reduces anxiety, pain perception, and treatment refusal, it becomes an ethical responsibility. When patients understand, they trust. When they trust, outcomes improve. And that is the true goal of modern dentistry, and that is what we should do, strive for better and use the power of visual stuff and visual aids, inspire and reduce patient anxiety and work towards improved patient care and satisfaction. Thank you.